Good day guys, I hope you are all doing well. Welcome to the Medic School Nuts. Today we are going to discuss about the epidural hematoma and subdural hematoma of neurology. So this is one of the most confusing and important topics of the neurology. So in this video I am going to discuss about the difference between the epidural hematoma and subdural hematoma. So at the end of the video we are going to having the case discussion. So by the end of the video you will going to understand the whole concept of the epidural and subdural hematoma pathophysiology and symptoms and presentation. So let's start with a discussion with a case. So a 37 years old male with history of seizures and secondary to the alcohol dependence presented as a trauma to the emergency department after being hit by a car. So 1 hour prior to the emergency department, he lost his consciousness on the spot, awake after the 15 minutes. So he went back his home and while having his lunch, he lost his consciousness again. So on the initial presentation to the emergency department, the patient was unconscious. He had a right parietal scalp hematoma with an overlying abrasion, but no palpable skull fractures. So his eyes were closed, but he did not answer the questions or follow the commands, so which is giving us Glasgow Coma Scale of 7. So both pupils are symmetric and reactive, so he appeared to be moving all the extremities symmetrically. No other traumatic injuries were found. So he required the treatment for the seizures, both before and after and during the CT scan. So after the primary trauma survey, the patient was subsequently taken to the CT scan where he continued to have the seizures and subsequently patient is died. So CT scan shows the biconvex lesion in the right parietal area and autopsy shows the hematoma in space between the cranium and dura meningeal layer. So what would be our diagnosis? Here you can see the hematoma in the autopsy. So before we are going to diagnose this patient, so at the end of the slide we are going to diagnose, and now we are going to discuss about the difference between the epidural and subdural hematoma. So let's recap of our anatomy. So in the anatomy here you can see that the brain is covered with the meningeal layers and the cranium, the bony part, covering with the skin. So let's zoom into this particular area and see the layers of the brain. So usually the brain and the whole body is covered by the skin. So down to the screen there is a skull. So skull is usually the bony part which consists the periosteum substances, and next to that we are having the three main meningeal layers which covering the brain and the spinal cord. So the three main meningeal layers, outer to innermost, is our dura mater, arachnoid matter and pia mater. So dura mater is which is the tough and the fibrous outermost layer and which is prevents the excessive movements of the brain. And next to that we are having the arachnoid matter which is consists of the trabecular meshes of the connective tissue, like we are going to have the CSF flow in this particular subarachnoid space, and the pia mater which is intact and highly vascular with the brain parenchyma. So these are the three main meningeal layers of the brain. And next we are having this hematoma formations in between. Here you can see the most commonly the epidural hematoma which occurs near the collection of the blood between the dura mater and the cranium of the bone. So the most commonly this is the arterial blood and which consists of the middle meningeal artery rupture. So next we have other subdural hematoma which is also most commonly seen in the trauma patients, and this is between the dura mater and the arachnoid mater. So this is usually due to the rupture or the tearing of the bridging veins which is flowing towards the superior sagittal sinus or from the brain parenchyma to the towards the dural venuses. And next, so epidural hematoma and subdural hematoma. Usually the epidural hematoma, as is shown you guys in the picture, it is collection between the space of cranium and dura mater. So when the patient having the trauma near the temporal or the parietal, especially at the Terrian region, so the collection of the blood is between the cranium and the dura mater space. So this is usually 70% of associated with the vehicular accidents, and it can also be associated with the assaults and the violent acts, wrestling also. Some of the cases have shown during the boxing or the wrestling in the temporal region also shown there is a epidural hematoma in the wrestlers, and most commonly this is due to the middle meningeal artery tear hematoma formation. So the treatment usually for the epidural hematoma is primary survey of the trauma care. So you guys already know that what is the trauma care: airway, breathing, circulation, disability and exposure and or environment of the patient. So next, immediate CT scan or MRI, first gold standard for the every trauma patient, and next the neurosurgery referral if you see the lesions of the epidural hematoma or the subdural hematoma. In the next slide I am going to show the what is the diagnostic features of the epidural and subdural hematoma. And usually the treatment would be craniotomy, immediate craniotomy, or the burr hole formation at the trauma region. And next, symptoms usually in the epidural hematoma is the most importantly the patient will have the history of trauma, and next patient will have the lucid interval. So what is lucid interval? Usually, again, I'm going to explain in the subsequent video, but before that, I'm going to just tell in a short description. So lucid interval is nothing but, so at the spot of the injury, the patient will have the loss of consciousness, but he will regain the consciousness again. Again, subsequent short period or the short interval, he will again have the loss of consciousness, which is deteriorating his sensorium. And the patient will also have the nausea, vomiting, which is associated with the headache, and decreased level of consciousness, and subsequent seizures will occur in the epidural hematoma. And what is subdural hematoma, which is compared to the epidural hematoma, is so the collection of the blood between the dura mater and arachnoid matter. So it is not between the bone and the dura mater, it is between the dura mater and the arachnoid matter, which is happening in between the meningeal layers, not between the cranium or the dura. It is happening in between the meningeal layers. This is due to mostly deceleration injury. Deceleration is most commonly associated with the vehicular accidents, car accidents, and usually even the patients who is alcoholics, elderly patients, and shaken baby syndrome, most commonly in the pediatric patients, we see this type of subdural hematoma. If you guys observe, I have highlighted that the epidural hematoma in the red color and subdural hematoma in the blue color, because epidural hematoma is mostly associated with the arterial blood, whereas subdural hematoma is associated with the venous blood. So this is due to the tearing of bridging veins. So most important to differentiate is it is associated with the middle meningeal artery, and subdural is associated with the bridging veins in between the dura mater and arachnoid matter. So as usual, treatment would be trauma care, ABCDE, and also immediate CT scan and find out what are the fractures or what are the hematoma formations, and next neurosurgery referral for the craniotomy or burr holes immediately. And symptoms would be, when it is compared to the epidural hematoma, most of the patients will have headache or not in the subdural hematoma, because subdural hematoma is always associated with the chronic or the subacute stages, but epidural is always acute in stage. And patients will have the headache and decreasing sensorium, declining consciousness, and seizures. And next, coming to the diagnosis. Here you can see the CT scan of the epidural hematoma. This is a non-contrast CT scan of the head, which shows the biconvex and the lens shaped, or you can also have the mnemonic like it is in the lemon shaped. So when hematoma is expanding its blood collection, it is going to have the herniation complications or the midline shift. Here you can see in the CT scan clear picture of the midline shift, mostly associated with the epidural hematoma. And also I want you guys to notice that it does not cross the suture lines. So you will observe in the subdural hematoma, the expanding blood will cross the suture lines. So here the subdural hematoma. In this picture you can see this is commonly crescent shaped and moon shaped or the banana shaped. So it is completely different, which is mostly associated with the subdural hematoma. And usually the arterial blood of the epidural will be expanding at that particular region only. But when it is compared to the subdural hematoma, it is going to expand that venous blood even to the suture lines, above the suture lines, and it will cross the suture lines. This is one of the most important to differentiate between the subdural and epidural hematomas. And next, as I said, I'm going to explain the lucid interval here. So this is the period of the time between the regaining consciousness after a short period of unconsciousness resulting from a head injury. Here you can see the intervals. I have just depicted the 3 intervals. So first, at the time of the injury, patient will have the loss of consciousness, and subsequently in the short period would be like 20 minutes, 30 minutes, even the 15 or 10 to 15 minutes. So the patient will have the he will regain from that unconsciousness subsequently without treatment. And if the patient is regained the consciousness, he will be normal. He is not going to show any symptoms like headache, seizures, or loss of consciousness, not going to show in this period. So he will work normally, he will eat, he will talk, and he will do any work in this period. But subsequently, again after the certain period, the patient will have the loss of consciousness again, and even he will go into the coma or deteriorating level of his consciousness and sensorium. Even patients die in the 3rd interval when they're having the again unconsciousness from the hematoma. So in this picture, let's recap in a short review again. So here you can see the epidural hematoma. This is between the cranium and the matter. So here you can see the skull fracture, and patient is having the expanding hematoma in between the suture lines. It is not going to cross the suture lines, and this is mostly associated with the middle cerebral artery. And next, subdural hematoma. Subdural hematoma is most commonly associated with the many bridging veins. In this picture you can see the brain parenchyma is having the so many bridging veins, which is going to drain into the superior sagittal sinus, where it is in between the dura mater and the arachnoid matter. That why if the patient is having the brain atrophy in the elderly patient, or the patients who are in the pediatrics, or even in the alcoholics, when they're having the falls, so sudden deceleration injury which will cause the tearing of these small bridging veins. So let's go back to our case. So here we can see the patient is having the trauma. He had the accident with the car. So after the loss of consciousness, here you can see the classic presentation of the lucid interval. So when the patient is having the injury, he already lost his consciousness on the spot. After the 15 minutes, he had again he regained his consciousness. Subsequently, again after he went home, he having his lunch with his family maybe, and he also again lost his consciousness. So when he is presenting to the hospital, he is unconscious already, which is spreading right parietal scalp hematoma. So CT scan, as I mentioned in the diagnostics, which is showing the biconvex lesion in the right parietal area. So crescent shape is for the subdural, which is look like banana, but in the biconvex lesion is mostly look like lemon shape, which does not cross the suture lines. So autopsy shows here you can see the autopsy in between the cranium and the dura meningeal layer. So the diagnosis of our patient is epidural hematoma. So I hope you guys are already having the some point of view between difference between the epidural and subdural hematoma. Most importantly, you guys have to differentiate between the where the lucid interval occurs, especially in the epidural hematoma, and where the venous tearing is happened. This is in the subdural hematoma. And most importantly, if the treatment is delayed in these patients, they may have the herniation of the brain, and they may also have the subsequent decreasing and declining conscious level and the sensorium. Patient will eventually die within the hours. And so don't forget to share with your friends and family, and please subscribe to Medic School Nuts.